Hello, this is Dr. Dr. Eric Potter from Sanctuary Functional Medicine, trying to swallow so I can breathe and talk for a moment. But I'm a functional MD who enjoys helping others understand their health better. One of the ways we do that is doing Facebook Lives every once a month, where we spend about 45 minutes to an hour both discussing and then answering questions about particular topics. Most of those do include topics about mold toxicity, which is a big issue that we deal with in our office, but it includes other things that overlaps with mold. So with that today, we are going to be talking about mold toxicity in children, pediatric mold toxicity. So as you come on board and are listening, I know many are on spring break, fall break right now, and hope you're enjoying that. If you're not listening right now and listen to us later, you can leave some questions. We'll try to get back to those. But if you're on board today as we walk through this topic, then you can leave questions. I will answer a few that have already been submitted, and then we'll get to those that are submitted along our talk today. So with that, I will, as always, start with a little discussion about pediatric mold toxicity. If you'd like to get in with us as far as help with one of your children, we can help you with that. There'll be a phone number later on. But what we're going to do is start out just a little bit about what does mold toxicity look like in children. Well, for the most part, it's both the same and different as it is in adults. It's same in the fact that it can be a multi-symptom, multi-system chronic illness in which the person is experiencing all these symptoms that seem unrelated, or at least don't have a good explanation from conventional medicine why they would be connected in the same person. And it's kind of out of nowhere. Someone's health has been doing okay, and it kind of either suddenly hits them or sneaks up on them over a few months. With that is what we're looking is again, a multi-symptom, so it's different things. It's not just, a runny nose or just a headache. There may be one symptom that is the primary issue, but it is several different things going on somewhat simultaneously. With that, multi-systems, so it's not just everything related to neurologic or everything related to GI. It is almost always going to have elements in different systems, where there's GI, neurologic, and skin, and cardiovascular, immune system. There's going to be more than one system involved, the vast majority of the times, almost always, such that those patients, whether child or adult, often get sent to several places, several different specialists, because, let's send you to the respiratory pulmonologist, let's send you to the dermatologist, let's send you to the allergist, trying to find some answers for each part of that rather than something that explains the whole. So it can be same as adults having those types of symptoms, but also different. Children will, as we say in medicine, a little bit like doing veterinary medicine. And sometimes, especially the younger ones, may not be able to talk and describe their symptoms to you. They just may cry. They may just be refusing to eat, or they may just be sleeping poorly. And even when they can't talk, they may not be able to describe, I'm having pains, or my tummy is upset, or I'm having nightmares and night terrors. So there may be many things that you do not aren't able to get a straight answer from with that. So, and we're going to talk more about that in a minute, but we're going to work through so the same and different. We're going to talk through how you identify this in children. You look for two changes. You're going to look for multiple changes, like we just talked about. You're going to then, to get them better, is work to remove and improve, then remove and repair, and then maintain. So with that, let's start with the fact that you're going to look for two changes. As in adults, often it is a change in life circumstances, whether it's moving into a new house, or there's been a big storm, whether there's been some water damage, there's been some renovation work, a change in schools that might be exposure to mold. So there's a number of different things that you can look for. So one change is some life circumstance change. The other is change in health. And again, this could be In the case of pediatric autoimmune neuropsychiatric syndrome, where you have neuropsychiatric syndromes associated with this, is the fact it could be just a sudden, out of nowhere, almost seemingly overnight, or it could also be something where it takes place over several weeks or a few months, where it's just slowly building up until like, well, when did this actually begin? So you want to look for a change in health, again, multi-symptoms, that occurred potentially suddenly and potentially could overlap with moving into a new house or a new school or some event, roof problem, or find out later looking back sometimes, and this is where we get to the muffled changes. Muffled mean you may not know that you had a water leak that was growing mold starting 6 months ago. You may not know that you had mold from a damaged crawl space 3 months ago when the symptoms started. You may not know that the school actually repaired in another part of the building a water leak that then allowed mold to grow. So muffled changes, things you don't know about. And again, like I said, with children, you may not recognize their symptoms just because they can't convey the messages. They can't, oh, well, I heard here with a stabbing pain exactly from 1 a.m. to 2 a.m., 3 to 4 out of 7 nights a week, associated with some photophobia and phonophobia. They're not going to have that good of a description. What they're going to do is they're going to cry, or they're not going to eat, or they're going to say, oh, I don't feel good, I want to lay in bed. There's going to be something else where they are expressing a symptom, and you may, or they may even not tell you that they're having constipation and not going to the bathroom for a whole week. So you're going to have to look for those muffled changes, as I would call them, either in life circumstances or in their symptoms. And from there, once you start looking at that, we're also going to talk a little bit about how do you diagnose. First, you have to suspect. Diagnosing, you're going to use labs. So with that, you're going to look at things like the C4A, TGF-beta. First of all, you want to get a good history by someone who is aware of mold toxicity, like myself or others that do this type of medicine, so that you can say, oh, well, this is worth testing. We're not, a lot of parents come in who are sick themselves from mold and ask, oh, should I have my children tested? Well, number one, do they have symptoms? If they don't, I'm not going to go on a fishing expedition just because mom or dad. Now, if that child does have symptoms and mom and dad have been diagnosed themselves, yes, we're going to look and we're going to do those tests, the blood tests. Now, there are some urine tests you can look at. They have some drawbacks, both sides. There's two different groups, and they will both emphasize one set or the other. We use both in some sense, especially in kids. We may look at using a little bit more of the urine sampling to determine mold toxicity, but we want to know if the body's reacting, not just if it's passing through the body. So a good history, appropriate testing, and that appropriate testing includes making sure there's no other issues that could be causing those symptoms. We don't want to blame mold for something that another infection or another toxicity is doing. So with that, then we get to the part where you remove and improve. So first of all, we want to get that person's body, particularly for kids, stronger. So we remove any other toxins. If you're feeding your kids non-organic or potentially pesticide-laden foods, we want to talk about having a low inflammatory, as natural as possible diet to limit or avoid as much as possible processed foods. Processed foods are going to have more chemicals, dyes, other things that can trigger and stimulate the immune system. Or dysregulate the immune system or cause other symptoms with the gut, like leaky gut. So we will remove those things that could be adding to the problem of mold. And we want to improve. For example, we want to improve their nutrition. If they're not eating a good rainbow of colors in their vegetables and fruits to know that they're getting different phytonutrients. If they're not having a balanced diet, they're only eating 1 or 2 foods. We want to try to make sure that they're getting the adequate nutrition that their body can then do as much of the detox itself. And often kids can do a pretty good job if we remove the things that were adding toxicity and improve the things they need, the nutrients, minerals, and so forth. They do a pretty good job of recovering from that. Now, once we get past that point, if children have not gotten as better as parents and the child wants to get, we look at remove and repair, removing actual toxins. So Besides helping the body do its own natural getting rid of those toxins, we're going to look at ways that we can boost the body's ability with binders or with things like glutathione, with charcoal, clay, and a number of other things that enables the body or pulls those toxins out. And then we're going to look at repairing. If they're having inflammatory symptoms, we're going to look at lowering inflammation with things that activate the NRF2 pathway and turn down the NF-kappa B pathway. If we're going to look at someone with gut issues, say dysbiosis, yeast, leaky gut, we're going to do things that heal the gut, things like omega-3s, vitamin A, adequate fiber, good probiotics, both in foods and supplements, and other nutrients and other supplements that can help heal the gut. So less of that bad stuff gets through and more of the good stuff gets absorbed in the GI tract. So we're going to work on repairing things that have been damaged during mold toxicity. That may include repairing some brain tissue, nerve. For kids, a lot of them get pediatric autoimmune neuropsychiatric syndrome. We're going to talk about that more in a minute because I did forget that a moment ago, is the fact that they can need things that are not just turn down inflammation in the brain, but adequate things like DHA, omega-3s to help the brain be more healthy, make sure they're getting enough choline, make sure they're getting enough of their B vitamins, particularly B12 and folate that they need. So we're going to help repair those things and also get rid of if they've got yeast or Epstein-Barr. We want to work on getting rid of those infections that add problems to a child's health. And then we're going to work on maintain. So maintain means that we, one, keep that child, whether it's an adult or a child, they need to stay away from mold once you get them out of it, which is one of the most important things. You also want to keep them from getting that toxicity back again. With that toxicity coming back, they're going to repeat that, needing detox, needing to remove and improve. We want to maintain the health, not just go back and forth, in and out of, back and forth between wellness and illness, wellness and illness. We want to keep somebody in wellness, especially for kids to have a life, healthier, more abundant life. Now, it's kind of walking through things relatively quickly. I'm going to answer some more questions in a minute, but let's take a minute to talk specifically about pediatric autoimmune neuropsychiatric syndrome. Many know it more as PANDAS, pediatric autoimmune neuropsychiatric disorder, associated with strep. But the PANS is when it's something besides strep, causing an immune reaction in the body, where it's attacking or causing inflammation in the brain, and in brain areas that can cause your child to suddenly have behavioral changes. So when your child wakes up and their calm personality becomes this OCD, worried about everything, hyper anxious, panic attacks, afraid to go out, obsessive compulsive, meaning they may go ahead and wash your hands over and over, or they never trust that the door's locked, so they will go back not just once or twice, but 20, 30 times checking if the door is locked, or they will never turn the light out because they're afraid. They can also have things like night terrors, where they're waking up in the middle of the night and they won't interact with you. It's like they're almost still asleep, but they'll be screaming like bloody murder. And you'll be like, what's wrong with my child? Well, they're still asleep, but they're having a nightmare, and suddenly they'll calm down and go back to sleep and not remember it. Now, it doesn't really hurt them, scares the daylights out of parents when it happens, but it's very disruptive if you're sitting up 20 or 30 minutes various nights with your child because they're screaming and crying in the middle of the night. And also, you don't know, what if it's something worse? What if they are having pain? What something else is going on? In those cases, if they're fine during the day, it probably very likely could be a night terror. With that, though, some kids get night terrors without mold toxicity, so it's not a guarantee. There's not one symptom that's 100%, yep, they've got mold toxicity, which is why we need blood or other confirmatory testing. But that PANS, with its night terrors, OCD symptoms, depression, anxiety, panic attacks, can be very disabling. Unless you're removing the trigger and getting the body to heal, they're going to continue potentially have those symptoms lifetime, at least, even though they may grow milder after puberty. For many, they continue late 20s and 30s and cause significant disability in their life. So with that, that's a little bit about a good introduction of pediatric mold toxicity, some differences. here at Sanctuary. Like I said, you can get in to see us as a patient. Stephen can answer the phone at 615-815-5941. If you'd like a written kind of laid out what mold toxicity looks like, we do have a new website, moldsymptomstreatment.com, where basically you can read through what we put together as a mold guide. If you're not want to know exactly that link, we'll post that in our comments so you can get that. But basically, it's what is mold toxicity? It has a smaller section on pediatric. What we've been talking about today actually goes into a little more detail, but it gives a good overview of the different systems. We talked about multi-system disease, different systems that can be affected, a little bit of how we treat, how we approach taking care of mold toxicity in our office. And with that, you can also, if you know someone who is potentially suffering and wants to know more about mold toxicity, that's a good starting point to help them understand. We share it with our patients, obviously, so they can help understand themselves, which is what we try to do, is educate our patients. And again, with these sessions, educate even those who are not our patients now or may never be, but we want you to have a healthier, more abundant life. With that, I'm going to go to a few questions that have already been posed to us about mold toxicity in general. And we're going to take the first question was, all right, there it is. My son was recently diagnosed with neurocognitive disorders, and I'm positive is due to the long-term mold exposure we previously had in our home. Question is, after there's no longer an exposure to mold, is the brain able to heal on its own or with treatment therapy? Also, what is the best way for children to detox, especially those who don't detox well due to genetics? So, yes, we have many patients who even for years after they have left the mold behind, they still have symptoms. They still have struggles. They may not be as bad. Some people get quite a bit better pretty quick after getting away from the mold, after remediating or leaving a house, but some continue to do that. So yes, you can have ongoing symptoms. That can be from the mold toxicity itself, or it could be the fact that mold toxicity opened the door to yeast, or yeast overgrowth, or to EBV, or to other issues that kind of took a life of their own on and continue. So it may be not just, oh, well, yes, detoxing mold, but it also could be getting a person's body back from illness into the wellness cycle, which is a different path, helping turn on the healing, restoring aspects like the parasympathetic nervous system, other cellular processes that we need to be functioning. So with that, just going to make my computer is running low, so I'm going to have Stephen plug that in. So to make sure we don't lose signal here, there's always something that's going to have that cord plugged in just a moment. If we cut off, we'll be right back. All right. I think we have power again. Excellent. So with that, we were talking about how to help kids heal. Kind of like I talked about in the introduction, which is a simple fact, is we remove other things that can be contributing to toxicity. We improve their nutrition. We improve the things going in them. And then we look at ways to help their body get rid of those toxins, whether improving their own mechanisms or giving them extra mechanisms like the glutathione, charcoal, and so forth. For the ones with neurocognitive disorders, sometimes they need either other therapies that help lower inflammation in the brain, or they may need, especially for adults, is some things like DNRS, dynamic neural retraining, or some other limbic system therapy like neurofeedback, where you're turning down those processes that have gotten somewhat hardwired into your brain, triggering symptoms and helping their brain heal. So it can be done. In some, again, you get away with the mold, their body does it, but some that are further down the road and more severe may need more help. There are things out there that can do that. So the next question, what are the best, most cost-efficient tests to determine if you're having a problem with mold? Where do you start? So I'm not sure which one, whether problem with mold in your home or problem with mold in your body. So I'm going to answer both of those questions to make sure I'm getting the answer you want. So in terms of your home, you want to look at an ERMI test. It is not cheap. It's in the $200 range, but that ERMI or Hertzme test, ERMI or HERTSMI. Those are tests where it looks comparing dry and wet mold, water damage building, wet molds in your home or any location, any building, to see if you have enough of the ones that are concerning, the Aspergillus, Scutonium, Stachybotrys, things like that, to give a good idea, is your home relatively safe or does it have a potential mold problem? And then you have someone come looking for it, so you're not just having somebody come in and wondering, well, they're just trying to sell me $5,000, $10,000 worth of remediation when I don't have a problem. So having your own testing where you can see if that's an issue or not. Yes, there are things you can do like test plates from different big box home improvement stores where you can get those and see how much. Those are okay. You can kind of look to see which one of the rooms, if you know you have some mold in your house, you could set different plates out, and for the same price of that one ERMI that just tests once, you could do several tests to see, is there a place that seems to have more mold? But ultimately you're not, it's hard to identify those even just by visualization. So even if you send that in, they may say, well, it's either Aspergillus or Penicillium. Well, the ERMI and Hertzme use PCR based, so they can tell exactly which species of mold you're having. So that's on the environmental side. From the individual side, the tests we are going to use are looking at C4A or TGF-beta 1. Those are tests that are our best screening. Now we will also utilize, as Dr. Shoemaker would say, VIP, MNP9, VEGF, and ADH, and a few other tests. Those are the big ones that are helping us to see whether or not someone has potential mold toxicity. You can also go online. There's a VCS, visual contrast sensitivity test, that will give you a sense of whether the mold toxicity is affecting your retina and causing some difficulty with contrast. But even if it's normal, that doesn't guarantee you don't have it. And if it is abnormal, there's a good chance you do, but it's even that those patients are not 100%. You want to make sure your vision is 20/40 or better. If you're 20/50, 20/60, that test is not valid, and we can't, we will not use it in the office. But we do use that on our patients, and you can do that yourself with the website, vcstest.com. So those are some places to start. Yes, you can do some urine mycotoxin testing. I mentioned that earlier, but you could be one who's getting rid of it well, and it's not really having an effect, maybe completely unrelated, or you may be having it trapped in your body and your urine looks clean, but actually it's causing lots of problems inside. So we take that test with a grain of salt. We use it at times, but pretty much are going to depend more on the C4A and the TGF-beta 1 to see if someone is mold toxic or not. And just to be clear, difference between allergies, toxicity, and infection. Mold can cause any of those three. Infections are typically in the immune compromised. Chemotherapy, high-dose steroids, the very young, say in newborn nurseries, or the very old in ICUs or nursing homes, whereas allergies affect a lot of us. A lot of people can be allergic to mold, sniffle, sneeze, snot, and wheeze, but others, toxicity is what we deal with, where the toxins are actually causing direct damage, not just an allergic reaction. And you can have more than one of those, especially if you have mold toxicity. It will trigger you to have potentially more mold allergies as well and suppress your immune system, so you might have an infection or overgrowth of yeast, which is another type of fungus. So there's different ways that I want to make sure you understand whether three different types of way mold can affect you. And someone else have a few symptoms come and go: chronic fatigue, brain fog, and weak. So that is a very short history. I know it's just a question, but I would say yes, that's a possibility, especially again if you noted that with some life circumstance changes, like say you were moving into a new location, you were changing houses, changed jobs, all of a sudden these symptoms start, and you don't have good other explanation for it. Because obviously chronic fatigue, brain fog, being weak could be from anemia. You could be losing blood in your stool and need a colonoscopy, or you could be iron deficient because you're not getting enough iron in your diet. So again, one of the difficulties with mold is that it overlaps so much with other issues, and we want to make sure none of those other issues are causing the symptoms. I don't want to blame mold for something that low iron is doing, or that B12 deficiency is doing. We want to make sure that's what it is, and we are not shooting in the dark. That's why we do testing, to make sure we know what we're treating. So yes, those coming and going symptoms. Now, I will say typically mold's a little more steady. The severity of the symptoms may change, but usually people are not completely well. Now, Lyme disease is a very similar illness in terms of reactions inside the body. It's also a toxicity besides an infection. Those patients can have very similar symptoms of mold, but their symptoms do come and go a lot because the Lyme more active and kind of comes in waves every few weeks. So that might be something that you look at. Like, oh, I've got a good week and then a bad week and 2 good weeks, a bad week and 2 good weeks. Maybe thinking about a tick-borne relapsing fever or one of the other tick-borne diseases. Another one. So does a person always have a mold allergy to have toxicity, genetic or a genetic marker? And there's a couple more questions, so I'll take these one at a time. But you can have toxicity, again, without an allergy. You can have an allergy, which tons of people do, without any toxicity. Now, toxicity can make an allergy worse or lead to an allergy later. However, they are 2 different animals that we're dealing with. Now, the genetic markers, there are those for mold toxicity, people that are more sensitive. Even those, though, if you've never been exposed to mold, just because you have genetics doesn't mean you're going to get toxic or how toxic you're going to be, but it does make you more predisposed to it. For allergies, there's probably some out there. I'm not aware of specific. There are some genetics will make you more predisposed to have allergies, period, but not necessarily mold. It could be pollen or anything else. The next question, what does a mold toxicity rash look like? Could it be eczema-like and not going away? So it could be psoriasis, it could be eczema, it could be hives, it could be just a faint redness, it could be lots of different things. It will take, as we would say, a great imitator of a lot of other issues. So if it's not going away, if steroids or antifungals or antibacterial ointments, therapies have not helped, and someone can't say, even maybe you've done a biopsy by a dermatologist and haven't got anything, oh, well, it's a nondescript inflammation. Well, looking for some of those things. It could also be related to mast cells. If they've not stained mast cells, which mold can trigger those to be more active and release more histamine. There can be rashes, and they can either be chronic and non-resolving, or they can be ones that fluctuate or even move around. So either one of those could be it, including ones that are eczema-like. And we've talked, what is testing involved? We've talked about that a little bit already. Another question that came in, is there testing for mold in the body? So the urine test is looking for mold coming out of the body. The amount of mold, if you say did a biopsy of fat tissue or muscle tissue or connective tissue or brain tissue, the amount of mold toxins that you would find there are extremely small. It takes only minuscule amounts to cause symptoms. And it might be here, but not here. So if you biopsy the place where there's no mold toxins, you might not find it. So we can't necessarily biopsy your whole body. That's called an autopsy, and that's not usually a good thing. So what we would do is we're looking for it coming out, and we will give things that trigger more of that coming out if we're going to do the urine test, which again, we don't use very much. Just a few instances where we do that. So as far as doing a biopsy or tissue like that, there's not. But there are things we can look at to see if your body may be reacting, and that's the blood test and some other tests. So let's see, I think those are the questions that I have. So I'm going to give us a few more minutes if anybody else has some questions pertaining to mold or pediatric mold toxicity or mold toxicity in general. I'll go back over while we're doing that a few of the things for pediatrics. Yes, we have to be more careful with children in terms of detoxing them. We're not going to be quite as aggressive, and we're going to use much smaller dosing. So sometimes parents will say, well, I've got mold toxicity, can I just give my child this? Well, I'm not going to be able to answer because I don't know their whole story and I don't know for sure that they have mold toxicity. The remove and improve, removing toxins, improving their diet, that's going to help everybody, whether they have mold toxicity or not. And if they do, it'll help them be healthier. Helping you to get away from mold, if mom and dad have genetic tendencies to mold toxicity, if they're remediating their house or moving or getting away from it, it's going to help the child as well. So that's a big thing. But with children, we do want to be careful, so we dose things much differently, and we might go a lot slower. Another fact about kids is we'll see a lot of food refusal. So some of your kids are only eat certain foods, or it seems like, yeah, some kids just don't like vegetables. Some kids are super tasters, meaning they taste bitter, much stronger, and that causes them not to like some of their good vegetables. But sometimes it is a fact that they are just having upset stomach, or they feel weird after certain foods they're reacting to because mold toxicity has made them allergic or sensitive to those foods. So another question, do all types of mold cause symptoms and issues in the body? So surface mold versus black mold. So with mold, you've got dry molds and wet molds, and that's a very general statement. But the dry molds are things typically cause more allergies. Those are ones you're going to find more outside, and it still may be moist, or maybe just on your walls right now in your house without any water issues, with good humidity, being below 50%. Those may cause some allergies, but they're typically not going to be making toxins that they can build up inside that you breathe in and make you sick. Whereas water damage building molds, like things like cardboard, they like drywall, they like carpet, they like wood, those do release toxins as they're fighting for those materials, fighting for those foods that they like. They will try to kill each other, and we get caught in the crossfire of those toxins they're releasing as they're trying to keep away bacteria, trying to keep away other molds, is we get caught up in that. So the other question, do you think it's important to treat MARCoNS? In most people, yes. And not necessarily in everybody. There are some people who really probably have no symptoms from MARCoNS, but there are many who have ongoing, whether it's acne, whether it's some PANS, the PANDAS type symptoms with the neuropsychiatric sleep problems where they can't get rid of MARCoNS. And yes, we will, in those patients, we definitely keep pressing. We will give at least 1 or 2 tries in all patients. If they've detoxed and they're otherwise doing well, and the only thing left is that MARCoNS, we won't necessarily attack it forever, but we do try to get them strong enough, their immune system strong enough where we can get rid of it. And that is our goal in the vast majority of the time. What is the treatment for pediatric mold? Again, remove any other toxins, improve the diet. We're going to try to remove those toxins from the body using binders, very similar except in smaller doses to adults. And we're going to try to get the body to repair, to heal up the damage that's already been caused. And what that looks like is going to be different. We do personalized medicine, so I can't give you a one-size-fits-all. You're going to find a lot of places on the internet and YouTube videos where they say, oh, if you just do this, it'll one-size-fits-all for everybody. It's not true. There'll be a lot of people who get benefit, and it's not that they're wrong, but there will be some who don't get better, or they say, I can't take glutathione. What do I do? That's when we pull, we have a list of things, and we start with the most effective, the ones that we know are going to work the best, and we work our way down. If somebody can't take glutathione, we work the next, or we have them take tiny doses, like using a toothpick, and build up so they can take a full dose of the glutathione. The next question, can mold exposure toxicity cause a positive ANA autoimmune marker? Absolutely. So it does cause dysregulation in the immune system. And a good way to think about that, it doesn't just suppress, it doesn't just turn it up. It actually, your immune system is meant to attack invaders coming in. What it does can cause your body to ignore invaders and turn on you. So it's like the guard dog that bites your leg instead of the burglar that's breaking into your house. With that, ANA, anti-nuclear antibodies, can go up, and we do see them sometimes go down when we're detoxing patients from mold, and turn off and turn down, or at least cause to be much milder their autoimmune disease. that's been triggered probably by the mold, or some other viruses and other toxins can do the similar thing. So yes, we do see the ANA go away sometimes, or at least get better. We're down to a moderate level where it's less likely to be causing problems. So thank you for that question. So I think, let's see, got time for a few more questions if anybody has them. But overall, I do want to encourage those of you who are facing mold toxicity you know about, don't give up. It can be overcome. For those of you who are wondering, again, look at our mold symptom website that helps people think through whether or not that is a possibility and maybe some ways to start looking at that. And also, just to, if you know somebody that you're wondering about that, is share that with them. But we want people to get better, and again, you may do some of those simple things, getting away from mold or meeting in your house. You may be 10 times better and not need us. But if you do, we're here, willing to help you walk through, especially those that when you're so sensitive to so many different therapies that you're like, well, what can I take? We'll help work with you to get your mast cells. Usually that's a mast cell issue that we work with a lot in mold patients and non-mold patients too, to calm down to where you can eat more foods again and you can tolerate more smells and chemicals and so forth. So with that, I think we're going to bring this to an end, and I look forward to our next episode, and I have to look on the calendar, and we'll post that in a comment further below. I don't remember when that is exactly, but it will be in November, and we'll be talking about another topic. Actually, we're talking about mast cells. I do remember that much. So we are looking forward to that, and until then, we hope you are living a healthier, more abundant life. If we can help you do that, 615-815-5941. Thank you, and have a blessed fall break if you're on fall break, and enjoy the fall now that we finally get some fall time weather. Have a good day.